Hello, everyone, and welcome back. It's my pleasure to be introducing, it's hard to believe, but our last session of the conference. So this is one that I know that you will very much enjoy. It's our next hour with Dr. Sinha. We're going to have time for discussion amongst ourselves before closing remarks. So in January 2023, Health Standards Organization, or HSO, released its new National Long-Term Care Services Standard. The standard was a result of 23 months of work and involved close to 20,000 Canadians, including many caregivers of people living in long-term care homes. And the idea is that it will provide homes across Canada with evidence-informed practices to provide safe, reliable, and high-quality care for residents. And now the work at hand is to implement these standards in homes across Canada. So joining me is Dr. Samir Sinha, who's the chair of the HSO, National Long-Term Care Services Standard Technical Committee. And we're going to learn about the standard, both things that are direct to long-term care and also things that more broadly support people aging. And we're also going to learn about how caregivers and council members can support the implementation of the standards in your homes. So Dr. Samir Sinha is probably well known by many. He's the Director of Geriatrics at Sinai Health System and the University Health Network in Toronto. He's also a professor of medicine at the University of Toronto and the Director of Health Policy Research at Toronto Metropolitan University's National Institute on Aging. A Rhodes Scholar, Samir is a highly regarded clinician and international expert in the care of older adults. In 2021, he was appointed to serve as a member of the Government of Canada's National Seniors Council and also recently led the development of the National Long-Term Care Standards. So we're going to invite Dr. Sinha to the stage to walk us through the standards, what affects long-term care, aging more broadly, and to discuss what do we do with this information. Dr. Sinha, over to you.
Thank you very much, Sam, and it's a real honor to be here today. I'm just going to share my screen, so give me one moment here. And I'm going to swap these. I'm going to use Sam to tell me in case I have my slides in the wrong order, but I think you should be able to see the presentation up nice and clearly now.
Looks good.
Excellent. Okay, so it's a real honor to be here today. And when Sam and I were discussing this presentation, we were originally talking about how family councils could help implement the new National Long-Term Care Standards. But we're going to talk a little bit about the National Long-Term Care Standards. But we realized that family caregivers across Ontario aren't just involved in the provision of care for loved ones in long-term care homes, but they're also, they're everywhere. They're doing such great work, especially to try and help people age in the right place, whether that be in a long-term care home, whether it be in a retirement home, or even being in in the community. So we wanted to zoom out a little bit and just share with you a little bit more about thinking about how we think about aging in the right place, wherever that might be. And also thinking about the role of family caregivers in all these settings, and then talk a little bit about the new National Long-Term Care Standards, and happy to focus questions on any of these aspects where I think caregivers play an incredible role, which is basically everywhere. So let's get started, and I look forward to dialoguing with you. We have an hour together, but I'm hoping that we can use at least 20 minutes of that for a nice engaged chat. So I've got three objectives here. I want to help us understand how the pandemic and our experiences have influenced our views on where Canadians want to age. I want us to appreciate how aging in the right place needs to begin with the development of what I like to call age-friendly communities and more innovative and flexible models of community-based care. And then also understand how Canada's new National Long-Term Care Standards can enable aging in the right place and really the role of family caregivers in implementing any of these ideas overall. So I want to give some context in terms of how we can think about our aging population, because right now, if you were to look at Stats Canada's numbers for Canadians right now, we know that 19% of Canada's population are 65 and older, as I like to say, 65 and better. But what we do know is that right now we often hear about our healthcare system not working very effectively, especially for older people. Because on any given day in Canada, we have about 7,500 older people, mostly older people, who are actually stuck in our hospitals. My colleagues in Denmark actually say they're almost like being held hostage in hospital because they can't actually get to their own homes with home care. And their families are saying, like, we can't take them home without appropriate home care supports. We need help to do some of this care as well. It may be about needing to go to a rehabilitation center. It may need to go to a long-term care home. But we know that people are stuck often because our system hasn't been right-sized to provide enough of the right care in the right place at the right time. As a result, this can be very costly, and right now it costs us about $2.4 billion, according to the Canadian Medical Association, on an annual basis, as the annual cost of people waiting to go elsewhere. So this is costly, and we know that this is only going to get worse, especially as our population continues to age, because within a decade, we know that a quarter, about 1 in 4 of us, is actually going to be 65 and older, 65 and better. In fact, we're just 1 year away from becoming a super aged nation when Canada will enter only a handful of countries, or become a member of only a handful of countries where 1 in 5 or 20% of our population is 65 and older. That's what the United Nations calls a super aged population. So we're close to that, and we're going to be even older within a decade when 1 in 4 of us will be an older person. So we know that when we hear all these sorts of things, we see headlines like this in the newspaper that Ontario's hospitals, for example, are unprepared to meet the needs of an aging population. And we know, it's not just these older adults, but often these older adults are being supported by an unpaid family caregiver, who's often doing a bulk of the amount of care and supports, and often is not really thought about in any of these equations. And we need to, because without them, the entire system would collapse as we know it. So the question is, how ready are we to meet the needs of an aging population? Well, we've got a lot of challenges ahead of us. So we know that our experiences also shape our perspectives, and it's important to kind of understand a number of different aspects, because for many older Canadians, accessing home and community care, continuing care, long-term care, usually means having to leave one's own home and community. Often we find that if care needs exceed what a person can get in their own homes from home and community care, or what their family caregivers can provide, if they need to go into a long-term care home or need higher levels of care, they often will have to leave their own home and community, and sometimes, especially if you're living in a rural and remote community, have to go somewhere else that could be hundreds of kilometers away. We also know that when one leaves their community and is away from their family, they're being practically institutionalized and may not be able to receive culturally safe and appropriate care close to their family and friends. And it's an unfortunate reality for many people. This became especially well known during the pandemic, when all of a sudden, when we really kept family caregivers out of long-term care homes, and really misunderstood the value that they were providing and the amount of care family caregivers were providing in these settings, we realized how detrimental this was for so many people living in these settings, because again, it's the importance of having access to appropriate care and being close to one's family members. That's why we know the value of having care settings closer to family members and friends, because that's such a huge important part of one's health and well-being. And we also know that there exists a universal desire for Canadians to age in place. And so how can we enable this for them and their families? So we also know that our realities need to be respected, because I was mentioning a little bit about small and remote communities. They often don't have they often don't support service and healthcare economies of scale. So often, it's hard to actually create, certain types of services when the population is so small. And it might be a very small population of older adults. There might be a small population of family caregivers, to create the right mix of programming in place. So sometimes when you're in a rural and remote community, you can be quite isolated from the right types of care that would help you in that community, and also for family caregivers, the right types of support. And as long as we also look at rural problems with urban solutions, we're often going to miss opportunities that clearly exist. So it's important to kind of think about some really cool opportunities and how we kind of scale distance and economies of scale by also leveraging technology and other things we can do to better support people. We also know that COVID-19 has shifted our perspectives, because we know that during the pandemic, when we polled Canadians, 91% of Canadians of all ages and almost 100% of Canadians 65 years of age and older reported that they plan to support themselves to live safely and independently in their own homes for as long as possible. So again, when you travel to any part of Ontario, you'll find that people are pretty clear on what they want and need and what families also want. I like to show this picture because this is the picture of the oldest patient I ever had. This is Granny Wabanow. And Granny herself lived in the Moose Cree community, Moose Cree First Nation. And when I met her, she was a remarkable woman. She actually was at the time the oldest residential school survivor living in Canada. She's the person who Stephen Harper gave the official apology on behalf of the Canadian government to residential school survivors on the floor of the House of Commons. And Granny also had an interesting career, because some of the things she did over her 100 and something years of life, she spent 35 years working as a midwife in the James Bay coastal communities, partly so that she didn't have to have young mothers have to go down to Kingston or Ottawa to have their babies, for example, that they could have them in their communities and they could be close to the family members and friends, because she knew how important being close to family members and friends was. So when I asked her during our consultations for the Ontario Senior Strategy back in 2012, well, where do you want to age? She told me, look, this is my community. My family here is here. This is my friends. This is my home. She says, but I'm really worried that if I need more care than what the community can provide, than what my family can support, that I'll have to move, to a whole nother city and be institutionalized in a long-term care home. And as a residential school survivor, you can imagine the last thing she wanted to have done is be reinstitutionalized so late in her life as she had been when she was younger. And so it's quite poignant, because those dialogues with elders like Granny Wabanow and others allowed us to create new programming in her community and others, where we were able to train local family members to become personal support workers, and because they wanted to have meaningful work and do things they could support older loved ones to stay independent. But by creating some extra supports, we were able to better support family caregivers. We were able to have more professional supports in place, and Granny was able to continue living and was able to die in her own community, which was her wish. So again, it's thinking about the roles of again, how do we support older adults to live their wishes? Even in small rural and remote communities, there are ways in which we can better support families and better create the right types of infrastructure to enable people to age in the right place. So we've done a lot of work through the National Institute on Aging, thinking about the roles of how do we enable aging in the right place. And we talk about our 4 pillars often: how do we support people to be independent, productive, and engaged citizens? How do we support people to lead healthy and active lives? How do we support more care closer to home? But you'll see one of the 4 equally important pillars is support for caregivers, because as you all know, there's over 8 million Canadians who are providing unpaid family care and supports for their loved ones. And in Ontario, according to the Ontario Caregiver Organization, there are over 4 million Ontarians who are providing care to another loved one. And so when we think about the role of caregivers, we've written about caregivers relentlessly in a lot of the work that we've done. But when we started looking at this idea of aging in the right place, we started by looking at, with our one report in 2019 called Enabling the Future Provision of Long-Term Care in Canada. That's when we started doing more in-depth reviews of long-term care. And then we did a subsequent report called The Future Costs of Long-Term Care, where we're able to actually cost out the contributions that family caregivers are playing, and also what will happen with our demographic changes over the next 30 years with the number of available family caregivers. And together, we actually, all of this information, the learnings that we had, we put together a whole framework called Aging in the Right Place, and really focused on one of the key elements there being the role that family caregivers play. So you'll see it in a lot of the work that I do, always comes back to the role of family caregivers. And that's why Sam and I wanted to focus, saying, how do we think about family caregivers, not just in long-term care settings, but really across the entire continuum. So when we redefine, what long-term care is, and should be considered, often people think about long-term care just being about long-term care homes. But really, when you think about the care that's being provided in long-term care homes, many family caregivers are sometimes actually providing equivalent levels of care in their own family homes with their loved ones, for example. And when we talk about long-term care, think about it as just care that somebody needs over the long term. That's really what it means. And you can imagine that it doesn't matter where it's being provided. It can be provided in people's own homes. It can be provided in retirement homes. It could be provided in long-term care homes. And often you have family caregivers involved right across that continuum, because they might be providing what we call ADL supports, which is help with bathing, dressing, toileting, feeding, those basic activities of daily living, we call them, or your IEDLs, which are their higher order tasks, things like banking, using the telephone, cooking a meal, and these are what we call IEDL supports. And as you note there in the purple writing beside that, the supports area, it says can be delivered by either paid care providers or unpaid caregivers, often family caregivers. And we also think about care that can be both responsive. So someone has a need, they need help taking a bath, so we respond to that need, we provide a bath. But it can also be preventive. And we don't spend a lot of time focusing on that level of care in Canada. But in other countries, they really focus that if an older person has now lost the ability to do something, can we rehabilitate them so they can start bathing themselves again, by teaching the family caregiver or paid care providers to do exercises and a rehabilitation plan to help their loved one, or help an individual regain an ability that they may have temporarily lost. So that helps frame it. And then what I want to do is talk about what we call aging in the right place, because you might say, wait a minute, I've heard about aging in place, but what's this aging in the right place? And so we really talk about aging in the right place as the process of enabling healthy aging in the most appropriate setting based on an older person's personal preferences, circumstances, and care needs as well. And we see not only do Canadians overwhelmingly prefer to age and receive care in their own homes, it's often less expensive than care in continuing care or long-term care homes. The challenge is that often, why I say right place, is sometimes I've got older patients, who are saying, I just want to keep staying at home, but it may not be appropriate anymore because, again, there's not enough government funded home care. Their family caregivers are doing an incredible job, but this is beyond what they can do at the home level. And sometimes I will work with family caregivers and my patients to say, you know what, I think this is time to move into a long-term care home so that a family caregiver can continue to be there and present as a family member in the levels that are appropriate for them, but also ensuring that the care needs and support for a person are being met. So again, the right place is, while a person might feel it's their own home, it might actually be a long-term care home. And it's always thinking not only about what the individual wants, but also thinking about their family caregivers along the way as well. And that's sometimes how we figure out what is the right place. When we think about the framework that we have for aging in the right place, we talk about 4 key pillars of activities. Number 1, it's about promoting preventative health and better chronic disease management. So again, there's lots of things that we can do to prevent certain illnesses from developing, such as heart disease, strokes, high blood pressure, but also things like dementia, because 1/3 of dementias can be prevented. But it's also thinking about all the different chronic diseases. Sometimes people are living with multiple chronic diseases, and often there are things we can do to help older adults and their family caregivers better manage a chronic disease to help alleviate kind of some of the challenges of staying healthy and well. We also talk about the importance of strengthening home and community-based care, but also, as you can clearly see, support for unpaid caregivers. Because again, it's one thing to say, oh, we'll keep people at home, but if we're just burdening family caregivers more and more, well, then how's that going to be useful to help keep people out of long-term care homes? We need to make sure that there is good, adequate home and community care, including things like respite services and other supports for unpaid caregivers. We want to make sure that living environments are safe and accessible, for example, and that there's the right types of housing that allow people to age in place and also support the roles and needs of family caregivers. And then finally, how do you improve social connections to reduce reduce loneliness and social isolation? So these are the core things that we think about that we focus on in our report that really does help enable aging in the right place. So the key is that when we think about the 430,000 Canadians that currently say that they have unmet home care needs, you can bet your bottom dollar that means that there's a huge amount of need of those unmet needs that then are placed on family caregivers. And again, if people burn out and people don't have just enough care between what their family caregivers and home care can provide, it's no surprise why we have tens of thousands of people on our nursing home wait lists. In fact, this slide says 40,000. This was from 2019. Now it's over 52,000 Canadians who are on our nursing home wait lists. And some of the challenges of this, like, why does Canada have a system that's not right-sized? Like, what's going on? Well, let's take a zoom back and actually look at the overall situation of where Canada stands versus the rest of the world. And what I want to show you here, and I got my laser pointer out, is just a few slides that kind of help anchor where we stand. So this is a graph showing 36 different countries, or what we call the OECD nations. I like to call these the rich countries club. So these are fairly well-off countries. And you can see that on average, this is kind of what is being spent on the provision of long-term care services. About 1.5% of our gross domestic product is being spent on the provision of long-term care services. Now, Canada is a bit better out of this group of 36 countries that includes countries like Greece and Chile and Turkey versus the Netherlands and Norway over here. So Canada is a little bit above this international average of 36 countries, but it's nowhere near what other countries like Netherlands, Norway, Denmark, and Sweden, some of the Scandinavian and other European countries are providing in terms of they're spending a lot more, almost twice the amount that we're spending on the provision of long-term care services. So that's a key point, number one. When we then look at how we're spending our long-term care dollars, what you can see here is this is kind of what the average is, but this is actually where Canada stands. Canada is spending the majority of its dollars on caring for people in long-term care nursing homes. It's also spending a significant amount of our dollars on caring for long-term care eligible people in there, or people with long-term care needs, whether that be home care or long-term care home care in hospitals. That's why this gray bar is so big, for example, as well. And then from that perspective, what you can see is if you go over to a country like Denmark, well, they're actually spending a lot of money on providing care. This purple bar is care in people's own homes compared to Canada, where it's a tiny amount. So they're spending almost twice what we're spending on the provision of long-term care services, and over half of what they're spending is on providing care for people in their own homes versus in long-term care homes, for example. And that's really important because it tells you that they've got a much more right-sized system with very few people in this light gray bar, like virtually doesn't even register because they're not actually caring for people in hospitals who are with alternate level of care designations, because they often have the right mix of services that allow people to go to their own homes with government funded home care, or to go to long-term care homes should people need it, or rehabilitation centers. They don't have the ALC crisis that we do because they put more money into long-term care services and way more of that money going into home and community care. This also shows kind of how we're spending our dollars in the provision of long-term care. And what you can see here is how we've been spending our dollars in terms of our long-term care dollars. The column on the left here that you see, this is about spending in institutions like long-term care homes. This is about spending on home and community care settings. And I'm sorry, my highlighting here shows Manitoba only. It should be showing Ontario, the Northwest Territories, and Nunavut, because what I wanted to highlight were these were settings where, for example, in Ontario, good news is we've increased spending on long-term care and long-term care homes by 82% over the last 10 years, but only 62% in home and community care. Remember, we spend the majority of our dollars on caring for people in long-term care homes. So we've had less growth in our home care budget than we had in our long-term care home budget. And then we wonder why there's over 40,000 people on the wait list for long-term care homes in Ontario. Same thing in Manitoba, where they've only grown while they've grown their institutional care budget by 33%, only 21% for home and community care. Same thing for these two territories. Again, more significant increases in their institutional care spending as opposed to their home and community care spending. So it really reminds us, again, how significant a lack of investment can really translate into trying to keep people in their own homes, and how we need to do a lot more from that way, because that's not just spending on home care, but also caregiver supports as well. When we look at what's going to happen over the next 30 years, we actually know that if we keep spending the majority of our dollars on institutionalizing people and not better caring for people and their caregivers in the community, which is what it's represented in the green versus the blue, which represents institutional care, we know that our costs are going to triple between now and 2050, to the point where we're going to go from 20 to about $70 billion in spending on the provision of long-term care services for older people alone by 2030. And that will represent 1 in every 5 income tax dollars. 1 in 5 dollars that's brought into government coffers is going to be accounted for by long-term care spending. That's if we keep forcing people or requiring people to go into long-term care homes versus bolstering more home and community care. The other interesting thing is when we looked at family caregivers, we saw that between 2019 and 2050, there's going to be 30% fewer close family members available to provide unpaid care. Someone saw this and they said, well, why are family caregivers giving up? And I'm like, they're not giving up. Family caregivers are doing an incredible amount of work. But we know that with declining birth rates in our society, we're going to have fewer people who are aging now who are going to be able to rely upon family caregivers and friends to provide their care. So we've projected that the number of family caregivers that will be available for the big aging population, where 1 in 4 of us is going to be an older person, is going to decrease by about 30%. And those remaining available family caregivers are going to have to improve their productivity by 40% to meet the future care needs of our older population. So again, how do you enable aging in the right place? And I want to walk you through a bit of a framework that we created a few years ago, because it helps us to understand where people are living, what their needs might actually be, and then in blue, what are those key models of care that can support both older adults and family caregivers as well. So when we talk about living for people who might be healthy and independent and living in the community, we talk about things like the importance of age-friendly communities, but also home accessibility and modification programs, enhanced home support programs, and also home sharing programs or co-housing programs as well. Things that allow people to kind of stay engaged and healthy in their community, allow models of living and care that allow people to be able to stay independent and live with others, that allow them to have their needs met, for example. And also thinking about enhanced home support programs, one being the VIP program run by Veterans Affairs Canada. And some of the programs that Veterans Affairs does is it actually does a lot of work to support family caregivers of older veterans, because it recognizes the financial costs, but also the supports that would help them be able to support their loved ones to stay at home. When we think about age-friendly cities, the definition from the World Health Organization is communities that recognize, promote, respect, anticipate, and respond to aging-related needs and preferences. And when we talk about what those things could involve, for example, this is a diagram that shows the idea of an age-friendly city and how there's so many different things that go involved in supporting people, such as transportation and housing services, for example, but also thinking about how accessible our public spaces are, the mix of community support and health services, and other things that help people stay engaged as well. Now, when we think about people who have moderately intensive needs, for example, so these aren't people who need to be in a long-term care home, but they could use some more supports, especially their family as well. We talk about things like community transportation services. We talk about preventative home visits and reablement programs, so things that can help identify older adults and family caregivers early, and better meet needs that in a preventative way, but also reablement programs that actually help people become stronger as well. We talk about the value of what we call naturally occurring retirement communities, and also community paramedic programs that can actually help older adults and their caregivers get some more support and services that can better enable people to age in the right place as well. For people who might be long-term care eligible, there's some really great models out there that can support unpaid family caregivers. I've often talked to a lot of my family caregivers about the importance of adult day programs, especially if they're supporting someone in the community that can give them a break or give them some nice peace of mind, knowing their loved ones are getting care while they have time to go to work or do some errands or just take some time for themselves. And there's other models of care as well that really look to bring long-term care back into people's own homes and allow them to be supported and their caregivers to be supported. And one great example that I use from the United States is called the PACE program, or the Program for Alternative Care for Elders as well. So I always say that we have choices and options, because when someone's waiting in hospital to go elsewhere as an ALC designated patient, that's about $750 a day. A person who's living in a long-term care home costs about $200 a day for their care. And then home care for a long-term care equivalent person costs about $103 a day. And so we know that often where people want to stay in their own homes is often where it's less expensive to provide care, but we can't do it while burning out family caregivers. And Denmark actually avoided building any new long-term care beds over 2 decades, and actually saw the closure of thousands of hospital beds by strategically investing more in its home and community care services. And we know that there's medical and technological investments that are allowing more people to be able to receive complex care in their own homes as well. So this is an example of what happens when you actually start bolstering your home and community care budgets. This is actually a graph representing people in Ontario who are either living in long-term care homes. Those are the blue bars, which represent people 75 and older living in long-term care home beds. As you all know, between 2007 to 2017, government Ontario didn't build many new long-term care beds. So the numbers stayed around the same, about 76,000 people who are all 75 and older living in our long-term care beds. But at the same time, you'll see the purple bar kept increasing. And especially between 2011, 2012 to 2016, 2018, you'll see a continued increase in that budget. And that's because that's when we started investing 5% more year-over-year increases in the home and community care budget. And by doing that, we were able to get more long-term care eligible people in the community, that's what the purple bars represent, to be able to remain in their own homes. We went from about 60,000 in 2011, 2012 to about 90,000 in 2016 and 17. And now the ministry tells me that number is about 120,000. So we almost have twice as many people who are long-term care eligible living in their own homes now than we did before, partly because we have more home care dollars available. But even more people, I would argue, could stay at home if we would better support their family caregivers and have more care that could be provided in their own homes as well. So now I just wanted to finish by talking about our new national long-term care standards. I think many of you will be aware of these, and the reason it is because we had over 18,000 people participate in our consultations around our national long-term care standards. And thanks to the help of Sam and others who really represent the voice of family caregivers, we had a huge response. In fact, I think 3,600 family caregivers in Ontario actually participated in those consultations. And so it tells you the level of engagement that family caregivers had in the creation of our new national long-term care standards. So Health Standards Organization and CSA Group, two separate groups, worked collaboratively on developing two national standards for long-term care. Many will be familiar with the HSO standard, which is focusing on delivering safe, reliable, and high-quality long-term care services. And then many of you might be aware of the CSA standard that really looked at how do we design, operate, and also the infection prevention control practices in long-term care homes. And I think it's important to think about these two areas in particular, because both of them involved family caregivers. I know 1/4 of the members of our technical committee were either residents or family caregivers who were very active in developing our new national long-term care services standard. And the CSA group had a committee of caregivers who were helping to advise their technical committee as well. I'm going to speak more about the HSO standard in particular, but again, the HSO standard really focuses on what long-term care home teams, leaders, and governing bodies could do. And it really identifies the importance of providing evidence-informed, resident-centered care that values compassion, respect, dignity, trust, and a meaningful quality of life. The importance of working in a team-based way to deliver high-quality care that's culturally safe, trauma-informed to meet resident goals, needs, and preferences. Number 3, it's about enabling a healthy and competent and resilient long-term care home workforce and healthy and safe working conditions. And then finally, upholding strong governance practices and culture that is outcome-focused and committed to continuous learning and quality improvements as well. So when we look at the CSA standards, specifically notes the design elements that enable less institutional-like settings and promoting more home care-like settings. And the HSO standard specifically calls out the need for appropriate staffing that will provide long-term care residents with at least 4.1 hours of direct care per day. And the federal government has actually pledged $3 billion to support the implementation of these standards and $1.7 billion additionally to improve staffing levels as well. But the key is again, we have a number of clear elements of the standards that really speak to the role of family caregivers, but while also balancing respecting resident rights. So allowing us to always remember that resident-centered care needs to start with the residents. And for many residents who are capable of making their own decisions, they will choose who their family is and how they want to engage family members in their care. We know as well there are residents who are no longer capable of making decisions, and therefore they might be relying on family caregivers to be their substitute decision makers, their voices as well. And so how do we make sure that those folks are also clearly engaged and supported? And then how do we think about the role of family caregivers? And I think that came out very strongly in the new standard because, again, of the importance we had so many people being involved in this work as well. So we can really enable a continuing care transformation. And really, when we think about what we need to do, we need to enable aging in the right place in a way that requires a shift in traditional thinking. We also need to appreciate that from age-friendly communities to aging in the right place, we can really create alternative housing options that can better promote independence, dignity, and respect. We need to make sure that innovative continuing care strategies can only succeed through collaborations and partnerships that can ensure the sustainability of our health and continuing care systems for years to come. And so with that, I'm going to finish my presentation. And now I think we have 22 minutes available for a good Q&A session. So I'm going to stop sharing my screen, and I'm going to invite Sam to help us moderate our session.
Thanks so much, Dr. Sinha, for that great information. So I'm going to go to the chat in a moment, but there's a question that's come up time and time again from what we've heard is, families have looked through the standard, downloaded it, looked through all of its double check 76 pages through the standard and say, this is great, but who do we talk to actually get it implemented? Or, here are certain things that we can do to improve at our home. How do we actually do that? What do you suggest for people to actually do, say who to talk to for that implementation?
Absolutely. So the one nice thing that we do have in Ontario is we actually do have legislation, and Sam's going to correct me if I get this wrong, that actually that supports the creation of family councils. And I don't know that every single home has a family council, but we do know that the majority of homes do have family councils, and that's a really good, important place to start. Because again, family councils end up being the voice of family caregivers, and really a clear mechanism where you have the support of organizations like Family Caregivers Ontario, but also or Family Councils of Ontario, and also your colleagues as well. I think the key is that it always starts with a clear dialogue, and making sure that we are recognizing the role that family caregivers can play and the needs to be supported. And so family caregivers, as part of their family councils, recognize the fact that, okay, these standards, okay, this is what these standards say need to be done. We want to make sure that these standards are being met, for example. So then it's dialoguing with the home and identifying what is being done well, and let's celebrate that. Where do we see an opportunity to improve some aspects? And again, what we do, and I think it's that dialogue that starts to say, okay, well, what's the barrier getting in the way here? Is it about training of staff? Is it about funding of care? It's about what are the things that are the barriers here? Because a lot of the things that we talked about in the standards are things that we believe, and again, this is in partnership with homes and other operators, that homes can do. Now, of course, we recognize that that homes have to be appropriately funded, they have to be appropriately staffed to really be reaching the level of care that's actually occurring. But I think really it's, if your home doesn't have a family council, form one, number one. Number two, start working in partnership with FCO, for example, because this is an organization meant to help support you in your advocacy and your diplomacy in trying to improve the care of your loved ones. Number three, often family councils have an opportunity to be involved, to be able to speak with the board, sometimes have representations on the board or the governance committee of a home, and also have a clear mechanism to liaise with the management and the leadership of the home. And then, use this as a constructive dialogue, right? We note at the very beginning of the standard that homes are going to struggle to meet the standard unless there is adequate funding and support for homes as well. So sometimes homes might be doing their best, but if they're not getting the right resources, it's hard for them to do all these things as well. But again, it's always thinking about what are the things that aren't happening. How can family caregivers work constructively with the home to make sure that that things can get implemented? Because often, again, we find that there are things that can be done. It just takes collaboration and cooperation and commitment. And homes want to do better. Staff want to do well. And I think this is my constructive advice, of saying, can we look through the standard as well? What do you think? Here are the things that we think can be improved. How do we work on that together? And often I think, homes are willing to collaborate and work with family councils and family caregivers to really move things in the right way.
Great. Yes, absolutely. Family councils are one really important way, and also for caregivers to reach out to the minister's office or the parliamentary assistant's office. There are other, try multiple avenues. So talking about the legislation in Ontario. So the government has said that homes need to comply with the Fixing Long-Term Care Act to meet requirements set out in their funding agreements, and that the Act and the regulations aim to support and enhance the delivery of quality care in Ontario. So homes aren't precluded from going beyond the requirements set out in legislation and regulation, and drawing from the suggestions in the standards. So what's usually your response to that? And maybe this is a tough question, it's always a tough question for me to answer. How do you see these standards complementing or aligning with the current legislation and regulations in Ontario?
Yeah, so I think, again, there was an interesting comment that came from the Minister of Long-Term Care saying, when these new standards said, I don't want to water down our standards. Ontario already has high standards. And so I think the Toronto Star asked me for a response to that. And I said, well, I think when the minister has a chance to read the standards, we'll actually see that these standards, which were written with family caregivers at the table, that these are actually even better than I think what the legislation suggests. I think, as Sam was saying, that the legislation doesn't preclude homes from going above and beyond, even going above that standard as well. And so there's nothing that's contradictory. In fact, it's only complementary. And I think these standards, I think these standards are really helpful in terms of really kind of being clear about what we want to do. The key is, interestingly, all homes in Ontario get funded to do accreditation as well. So all homes get funding, but we know that 15% of homes don't participate in any accreditation activities, number one. And it's mostly the not-for-profit homes in Ontario that accredit themselves using the HSO standard. The majority of homes in Ontario accredit themselves with a US standard from a group called CARF as well.
Mm-hmm.
So again, there's an opportunity to dialogue with the home to say, are you aware of these standards? We can actually measure ourselves against these standards if we accredit ourselves, with, for example, Accreditation Canada, which is actually recognizing the standard and going to be using this as the basis of accreditation. But I think this is kind of a way in which these standards being recognized, because in other provinces, all the homes, it's mandated. In Quebec, for example, they've mandated that all homes will be accredited against this standard. And that means that everybody is now being accredited against this in a way to say, okay, when we're being accredited, are we meeting all these standards? Are we not? And there's an opportunity to kind of work together, with families, with residents, with staff, to say, how do we actually achieve these standards as well? So I think this is the important thing, that I think these standards are complementary. I think these standards really speak to where we aspire to go versus where we just want to kind of settle. And I think there's a huge role that we recognize and help to define in the standards to clearly say the role that family caregivers can play. And certainly one of those is around advocacy for improving the standards in our long-term care homes. And as Sam said, it's working with organizations like FCO, which has good connections with the minister's office, can hear your concerns and say, hey, how do we actually improve things to support family caregivers?
Great. So you mentioned federal government support for the implementation of the standards and for staffing. So what is that going to entail? How is that going to play out in Ontario, that additional funding?
Yeah, it's a great question. So right now, there were some big announcements that occurred a few months ago about billions and billions of dollars more coming from the federal government in their transfers. They specifically have this funding, $4.7 billion and then some, which is supposed to be around, I think they're calling it dignity for older people, or aging with dignity, is what they're calling. Right now, each of the provinces and territories is negotiating with Ottawa about how they would spend those dollars. Mm-hmm. Ottawa wants to see money being spent to help implement these standards, and also to improve staffing, for example, there. So I think one of the key things that groups like FCO and folks who are listening today can really participate in is really focusing on okay, what do they want to see Ontario asking for? So what should the Minister of Long-Term Care, the Ministry of Long-Term Care, be asking for that can help support the implementation of standards? So if you're saying, hey, in my home, this is where we're really lacking, we'd like more support around X, Y, and Z, because that would actually help us better, feeding that information up to a group like the Family Councils of Ontario can be really helpful, because that could help influence what Ottawa is negotiating with Ontario around to better support kind of residents and family caregivers, especially in a place like Ontario as well.
Mm-hmm. So call to action, review those standards, think about how you may, as a caregiver, as a council, want additional monies to be spent, and contact the ministry. Let us know what you think about this as well, because while we're not a lobbying organization, we do public policy input. So as you alluded to, our connection. So that is definitely an important action that folks can take.
Absolutely.
So Robert's asking, what's the best way to reach out to and support those who may not have family caregivers, friends, or a community? Many older adults live alone on their own, but, have helped to build Ontario to be what it is. So how can we support those who maybe don't have those family caregivers or other unpaid caregivers they can rely on?
That's a great question, Robert. And I think you've done a really helpful kind of point to make. Like, sometimes we almost kind of forget that there are people who don't have family caregivers. They don't have people in their lives, who either are biological or chosen family members, or even friends, who are, if you will, family caregivers to an individual. So there are increasingly a number of people who are isolated, whether they actually live in a long-term care home or whether they actually live in the community. And the question you asked was like, how do we support those folks? Well, as it really can just be, if you identify someone, for example, you can sometimes if they're a person living in the community, you can drop a note off and just say, hey, my name's Robert and I'm your neighbor. I just live across the way. Or, if you ever need any help with things like getting some milk or groceries or whatever, here's my number. That's something we actually were promoting quite a bit as the National Institute on Aging, called Viral Kindness. It was just, we gave these little cards that people could fill out with their information and give it to somebody that they identified who might benefit from their help, as just a way to kind of make that connection. Because sometimes, there are people who are on their own, don't have any family supports, and don't want any family supports, if you will. And there are others who would desperately want that, because, again, that additional support can be so helpful, from doing day-to-day chores to actually have someone who can advocate on their behalf as well. So I think certainly we shouldn't ever make assumptions, but certainly there are a lot of people out there who might be isolated, would really benefit from having. And in terms of how do we support those people, it starts with just identifying and asking them and seeing if there's a way that they think you could support them.
And there's also different nonprofit and community groups that do supports for seniors. I volunteer with one, and they have friendly visitors, where volunteers will just call or spend time with an isolated older adult, once a week, and they can be, doesn't have to be a super strong tie. It could be one of those, we call them weaker ties, but they can really improve someone's well-being in the community.
Absolutely. And that's the thing, right? Sometimes, as to Robert's question, again, it's not just identifying someone and you being the solution, for example, but it's also sometimes getting them connected, right? And saying, hey, I know of a great organization. And as Sam was saying, in Ontario, we call them community support service agencies. And there's about 630 of them across the province, many of them focusing on meeting the needs of older adults with friendly visiting programs. They might run adult day programs. They might run community transportation options, things that can actually doing tasks or supporting people in the way that a family member might actually do as well. So thank you for pointing that out, Sam, as well.
Yeah, and there's also, more campuses of care that are seeking to make those connections between community, retirement, and long-term care.
Absolutely.
Is there, and maybe this is another hard question, if you had a magic wand and you could choose that all of Ontario's long-term care homes implement one of the standards, where would you want to start?
Oh my God, that's such a great question. I would just say, we're already going to get there, so I don't want to make that my one choice, for example, but it's about the 4.1 hours a day standard. Like, actually, Ontario, Nova Scotia, Manitoba are all committed now to getting to 4 hours a day. And I think that's really important, because if you just don't even have staff, it's just like, how can you do so many of the other key things that we talk about in our standards? So that was kind of an easy one, but I'm not going to use that one. I think it was, I think what really moved me quite a bit was, making sure that we, if we're really talking about resident-centered care, it really it's really the standards that really talk about developing, a care plan, for example, that truly is resident-centered. It's asking residents what matters most to you, and getting their support. And it's really about really kind of asking residents who they are, what they need, and really incorporating that into a care plan that really actually matches more with what they want and need, as opposed to what works for the convenience of the staff, for example. So it really is that focus on resident-centered care that I think is really important. I saw a question that came up saying, what does 4 hours a day look like? And is it one-on-one care? Yeah, that's 4 hours of direct one-to-one care. Because right now, when at the start of the pandemic, I think we were providing 2 hours and 45 minutes a day on average per resident. And so this is a significant increase to better meet people's needs, but this is one-to-one care, because we know that in a long-term care home, you don't get 24-hour care, for example, but it's making sure that each resident has about 4 hours of direct one-to-one care with a healthcare provider, whether that be a personal support worker, a frontline nurse, a therapist, etc.
Mhm. And I think a lot of what you've talked about, so the care plan example,
Mhm.
is really putting, walking the talk, that we don't just want the standard or a care plan to sit on the shelf. It has to be something that is implemented and that is actually put into practice, because otherwise all this work, tens of thousands of people's efforts and input and so on, won't come to fruition. We know that staffing is a huge barrier. What other barriers do you see, specifically in Ontario, but for the successful implementation of the standards? What do we need to overcome?
Yeah, so A, there's staffing, but B, also it's kind of training, right? It's making sure that everybody is given the support and knowledge they need to play the best of their roles. So I think everybody has a role to play in a long-term care home, for example. So residents obviously have their roles to play in terms of being able to, supporting them, in terms of communicating their needs, their wants, their preferences, how they want care to be. There's a role that family caregivers clearly, play, and how do we respect, and welcome their roles and support them to do their roles well. And then there's the role that the staff of the home play well. And so it's not just about having people show up; it's also making sure that they actually know, and they know what their roles can be and how to do those roles. And sometimes it's just providing people education and support so that they can do that. So I'll give one kind of interesting example, right? People were really afraid to have family caregivers in homes because, oh, they're going to bring in COVID and it's going to be terrible. I said, well, if you think about it, I said, family caregivers do not want their loved ones to be harmed. So if someone has symptoms, they're probably not going to come in. And if someone's going to be extra careful about their gowning and their PPE use, it's going to be family caregivers, because you don't want to go in and kill your loved one like that. You're the last person who wants that to happen. And so that's where we really kind of said, look, what we need to do for family caregivers is give them the knowledge and skills, because if they are now trained also in infection prevention and control measures, if they actually know how to gown and glove, they can actually, be supported to actually visit more safely with their loved ones, for example. And they started doing that early on in May of 2020 in the Netherlands, and saying, if you treat the caregivers like staff, if you give them the same knowledge and training as staff, then they everything's fine. And it truly is, kind of remembering that everybody needs to have the knowledge and skills. We need to make sure that, particularly for staff, they know about how to manage common chronic conditions that occur in long-term care settings. For example, they know how to provide the right care to individuals, how to respect the role of family caregivers, but then also making sure that family caregivers have the appropriate training so that they can be a more effective member of the care team.
Absolutely, making sure that families are supported, educated, trained. This harkens back well to what we talked about yesterday with the Ontario Caregiver Organization about the Essential Care Partner program and the ID. That's very much aligned.
Right. I saw Leslie's question here, if I can answer that one, because I think, Leslie, you said that our LTC home allocates the hours for each resident based on the staff's perceived need, pooling the total hours. Is this usual? And yes, actually, it is usual, because what we do note is we're talking about an average of 4 hours a day per resident. We know that there are some residents who need more than 4 hours a day. They might need 6 or 7 hours a day. We have some residents who are quite independent and actually don't need that much care and can actually do some of their own self-care tasks. So for example, it's not that someone lords over them for 4 hours saying, I've got to be here, I got to do something. A resident might only need 2, but on average, what we've looked at is about 4.1 hours a day that is needed. So that's reasonable. But again, if you as a family caregiver think that someone's not getting enough care, that what staff perceive may not be what that person needs, that's an important role that a family caregiver can play to advocate to make sure that a person is getting the appropriate amount of care that they should need.
Wonderful. What a great way to wrap up our hour together that has gone by always so quickly, our time together, Dr. Sinha. So thank you so much for your time with us today, for your work with the national standards, and more generally as an advocate for older adults, for an effective long-term care system, and for the role that families can play in shaping a better world. So thank you so much for your time. It is always a pleasure, and best of luck with everything to come as you continue to advocate for older adults.
Well, thank you very much, Sam, and thank you for the work that you do and the work you do with Family Councils of Ontario. It's been incredible, and you've been an incredible partner in actually enabling us to get the standards to where they're at. So I just wanted to say thank you to you in this very public forum, because without your support and advocacy on behalf of family caregivers across Ontario, the standards wouldn't be at the level of caliber that they are. So a huge thanks to you, your organization, and all your members, because honestly, if you're happy with the standards, because you made them happen as well.
All right. Thank you so much for those kind words. And I'm seeing lots of love showing up from the reaction. So always a pleasure. Thank you so much again.
Take care, Sam.
Take care. All right, everyone. So that we can have more chats around national standards. This is really the time in our program where we can reflect on what we've learned so far since Tuesday evening about these sessions, about what we do next. So I'm really going to throw it open to folks before we take 10 minutes or so for closing remarks and wrap up. But I just want to know, maybe enter this into the chat. What questions do you have from what we've talked about so far? Or what are you going to take away and take back to your home, to your council, and say, let's do this, or let's try this? What are your takeaways from our time together? I'll just give you a moment to consider. So just to, we've had discussions on misinformation and how to identify misinformation, how to work with folks who may be repeating misinformation. So Professor Caulfield worked us through some great stuff there. On Tuesday evening, Tiffany had led a session on public policy, spheres of influence, where you can make your voice heard. We had Alison Kilbourne from the Ontario Caregiver Organization talking about the Essential Care Partner Program and ideas for how councils can support the implementation. We had members of our Diversity, Inclusion, and Equitable Representation Advisory Committee talking about equity and belonging and how to foster that in long-term care. Fantastic session today about resident and family council collaboration, some best practices and examples. Family councils as change makers with Alen and Anita and Tina Gray talking about their examples of making concrete changes in long-term care. And then, of course, just finished with the national standards and a discussion about implementation. I think, what Kathleen is saying in the chat is baby steps. We might want to change the world immediately, but it's a little bit harder. There's a saying, how do you eat an elephant? One bite at a time. Like any sort of major change, we do it a little bit at a time. It can also help us maintain our momentum that way and not get burned out. And remember, just like with residence councils, if you're a family member of a home, you're a member of that council. So that is one way, one place to have your voice heard and to make sure that you have access to the peer support, the education, the advocacy that is made possible through engaging in those groups. It is a really important area of activity within a long-term care home, brings a lot of life, new ideas to that place. Let's see who else. Leslie is, thanks so much, Leslie, that this has been very enlightening and moving. I'm so glad to hear that because that was our goal. And and a specific thank you to Anita and Ellen for talking about what their family council is doing so that Leslie's baby family council can get some ideas. It is possible and it is great. And Deb is saying, takeaway is a welcome package. So we have a really exciting project that we're working on that is really responding to a need that we've known about for some time. And if you've seen some of my presentations in the past, I've sometimes made a joke about show of hands, who got the intro to family or the intro to long-term care package, the what to expect. Radio silence, because it's not something that really exists. So we're looking to compile, there's different resources out there. Many homes have welcome packages, councils do. But what we're looking to do is create a what to expect guide in long-term care. So we had a survey that went out. We're planning some focus groups. So that way we can collect a list of the questions you know you have or had now, but didn't know you needed to ask before long-term care. So that knowledge that you wished you had, but you didn't. So we can compile that and try to get that information out to community caregivers. So through family doctors, through community care centers, and so on, to help a new wave or a new generation of caregivers be better informed and prepared for long-term care. So stay tuned for more. There's some information on our website, but you can also reach out, just ask for more. If you have templates of or samples of a welcome package or something like that, or a brochure, send it to us. We'll post it online on our website with your permission so that others can learn from your work. Definitely revisit the national standards. So I've dropped the link in the chat. You need to order it, but it's free. So it's available in both English and French. There's two standards. One is very technical, things like air conditioning and hallways and window openings. But the HSO, long-term care services standard, is it's a total of a 76-page document. The actual standards, the content is shorter, but it walks through things like the home team designating a team member to coordinate the resident's care before, during, and after a consultation with a healthcare professional outside the home. It discusses things around the home leaders demonstrating that the number and skill mix of the workforce is evidence informed to enable team-based care. So there's lots of information there around the goal and the guidelines. And so take a look at those, refer to what's happening in your home. And as Dr. Sinha said, discuss like, where are we now? What is the gap? And how do we bridge that? And just take everything back to your family council members. Doreen's saying, we're taking things back to review your goals, your priorities, and collaborative relationships, using the ideas from Anita and Ellen. Let's see what else. And, Deb is saying that they're working on this right now, what you need to know in long-term care. So Deb, connect with us because we'd love to learn from your work and incorporate what councils have demonstrated to be useful. So that way, when we can reach out to folks before they make that long-term care transition, they will be as knowledgeable as you. I will put again the site, the information for the long-term care standards in the chat. So I'm dropping that in now. Also, if you Google National Long-Term Care Standards, you'll come to the HSO website, and you'll be able to find it. If in the future you can't, just get in touch with us, and we'll be happy to connect you. And I'll echo what Leanne is saying, that we know, everyone knows change is needed, and through working collaboratively, we can create amazing positive change. And together we can and we will make it happen. So I'm glad to see that there's definitely a few great things that you can take back and create actions on. As for question around when the videos are available. So if you are in your Zoom events portal right now, that's where you're watching this from. If at the top you go to the word sessions within that teal box, you should see where the join button would have been to a session is watch recording. So the recordings will be available within this platform. So getting back to it via the link that was in your email from Zoom events will be available until end of day, June 22nd. So it's 2 weeks from now. You'll have access through here. And then we'll be working on over the summer, taking those materials and uploading them to YouTube and releasing that information in our e-bulletin. So everything except Timothy Caulfield's presentation will be available again in the fall. His is just because of copyright issues, but everything else will be available in the fall. So you'll be able to review it, you'll be able to share it widely. But for the next 2 weeks, you'll have access through this portal. It's as easy as clicking watch recording and just making sure that your audio is on. I was double checking that last night, and that was the only little hiccup, is making sure that you click the little speaker button. So thank you to everyone who has joined. Oh yes, Alan has put CARF accreditation into the chat, but I'm also going to find views. We actually had a webinar that we hosted on, it's called Person-Centered LTC Communities, an Introduction to CARF Accreditation for Family Councils. So I am going to drop that in the chat now. That is a great session to watch. It's a little bit over an hour about CARF accreditation. So review that. That talks about the process for CARF, things that are in the accreditation. So, and I'd say also ask your home, or if should be on their website, which they should have, about if they're accredited and by what organization. Because then you can look to see, you can actually ask them to walk you through what the accreditation. Yeah, Benoit saying use double time and only be an hour. If I ever have to listen to the sound of my own voice on recordings, I speed it up too. So definitely take a look there. Look at the session. Also, we have a variety of other sessions available on our YouTube channel. We've got archived sessions that were put on by the ministry. So the long-term care regulations update, pandemic response is available there. If you're interested more in models of care, so there is one that was around institution to home and long-term care, humanizing dementia care, and we also had a session about the Care TO, the City of Toronto model. Those are also things that you can look at and think, how does this align with what I've heard over the past couple of days around national standards, around engaging families in long-term care. So definitely take a look at our YouTube channel, Lots of great sessions there. That's the general link. No, it's not. This is the link. You can also get to it right from the homepage of our website, fco.ngo. You can see how my hair color has changed over the years, if that might be entertaining. But it is a wealth of information. Make sure to follow us on Facebook and Twitter. Make sure you're signed up for our e-bulletin as well, because that is how you will get information about the event recordings. It'll be how you find out about future events. I promise the link that I'm putting in now, which is a long one, is not spam. It is the link to sign up for our e-bulletin. So if you're not there, definitely sign up. It's the best way to stay connected to the work that we're doing. So I'd love to see what folks have put in around the resources they're going to take back, what they're going to explore with their counsel. And then I will give a few closing remarks. I'm so pleased that you were able to join us over the past few days. I hope that you got what you wanted out of our time together. It's always such a pleasure to connect, whether it's in a virtual or in-person space, to learn and network. If you have any questions, thoughts, or looking for a resource or a document after the conference is done, send us an email. You can find all of our contact information just at fco.ngo, familycouncilsontario.ngo. Just one plug, FCO is a registered charity. We are mostly funded by the Ministry of Long-Term Care, but appreciate any donations that folks feel are appropriate to give. So you can find out more, check our registered charitable status, find the link to donate on Canada Helps via our website as well. It is through the sponsorship for events and individual donations that we're able to pull off events like this, our conference, and other virtual and in-person events. So every dollar is valuable to us, and we appreciate the support. Final thank you to the organizing committee that Kathleen had worked with. I know so much went on behind the scenes to make this a reality. Thanks again to Tiff for the several sessions that she's presented this week. And again, if you have interest or questions about our public policy work, how your council can engage in public policy input and dialogue, reach out to Tiffany. I know she'd be happy to connect with you. If you're looking for general support, you have questions about family council work, Leanne and Natasha are your go-to folks. Leanne Polisi is our bilingual client services manager. Natasha Dupuis is our bilingual outreach manager. Natasha is available and loves to do presentations and consultations with councils, and is available to support your work. Kathleen, once again, Kathleen also does our education development and our e-learning. So if you're looking for a presentation, you don't see anything that's quite right on our website, quite what you have, ask Leanne or Kathleen. For information about our communications, our e-bulletin, our YouTube channel, social media, if you have an event or something that you want us to help promote, Leah Cabral, they are communications manager, and will be happy to hear from you. And along with their colleague Taeyang Jung, who it does our accessible and French e-bulletins. Dinesh Ram is the person who has been running your Zoom event and working tirelessly to make it a success, work out the hiccups along the way. As we chose this platform because we could do interpretation, and that we decided that was one of the most important things to us, and had to switch plans partway through planning in order to be able to deliver on the interpretation. So we appreciate your patience and your kindness as we had some hiccups, but we know you're always gracious about that. So to everyone who attended, thank you for choosing to spend your time with us. Yeah, we definitely are grateful that you've made that choice, and that you can choose to do your family council work. So really, this work is for and with you, and this is the reason that we do what we do. So we are so appreciative, so grateful that you were with us over these past few days, and reach out, stay in touch. You will get a survey asking for your feedback. That should go out today. So we absolutely would love to hear what you thought, what we could do better, what you particularly enjoyed, so that we can continually improve our events and what we offer to you. So everyone, a final thank you on behalf of the FCO team, our incredible speakers. Thank you for spending your time with us. Remember, check out these sessions that are available still through the portal, connect with the speakers and the people who have registered, and be in touch. Okay.